Hi, it's Dr. Jeni here with Thrive Chiropractic and Functional Health in Branson, Missouri. And today I want to talk a little bit about breast cancer and estrogen dominance and all that stuff. Um, as you know, probably October becomes Breast Cancer Awareness Month, so I'm getting a little jump on it because it's a big topic. And I see a lot of women who are concerned about it or have it or don't want to get it. So anyway, let's talk about estrogen dominance, which is a kind of dominance you don't want to have. And that is just when you have, relatively speaking, more estrogen than you do progesterone. And so your hormone teeter-totter is off balance, so to speak. And so what that looks like symptomatically is painful, heavy periods where you're bleeding 6, 8, 10, 14 days out of the month. Things like uterine fibroids are driven by estrogen. Fibrocystic breasts, that's where they feel hard and lumpy and you wonder, do I have breast cancer? Is that a lump that is no big deal? Is it a big deal? What's going on? And the Mayo Clinic actually estimated that 50% of women have this change in breast tissue called fibrocystic breast disease, or there's a couple different names for it. And the medical community will tell you that, oh, it's just normal, it's a normal variant. But in the functional world, where we're dealing with optimal health, not just the absence of disease, it's a thing that you should, if you have it, you should wake up and go, are my hormones in balance? And do I have relatively too much estrogen? And if so, what do I do about it? How do I test for that? And so what you want to ask yourself is, are my hormones in balance? And the best way to test hormone balance, test-wise, is a saliva test, where you spit in a tube and send it into a lab, and they tell you what everything is. And you can look at types. There are 3 types of estrogen, so the type of estrogens you have matter, and your risk of breast cancer can be evaluated based on the types of estrogen you have. Your progesterone levels, your testosterone levels, DHEA is an important hormone. And then I usually will tie in a hormone panel on a woman with a stress index, because hormones and stress are intimately linked, and a lot of people are just under stress. And so that plays into it too. So that's how I do testing in the office. And that's really the only way to know for sure. But a lot of times, like I said, if you have changes, fibrocystic changes in your breasts, or you're bleeding heavily, and or you have fibroids or something like that, you'll just know, hey, I'm relatively estrogen heavy, especially if you've spent any amount of time on oral contraceptives or hormonal contraceptive options. A lot of times those are estrogen medications, so they're promoting estrogen. And so as you come off those, there's usually a detoxing process that you'll want to go through, and how do you do that? So anyway, just wanted to throw that out there and let you know that it's not normal. If that's something you're dealing with, you should do a little investigating. And some of the things that you can do are to evaluate the beauty care products that you're using. Makeup is very notable for containing things called parabens, which are endocrine disruptors, or basically that's a fancy big way to say they screw up your hormones. And so it's in makeup, it's in lotion, it's in shampoo, it's in everything. So we want to eliminate the parabens from any kind of personal care product that we can. We want to use cosmetics that are clean. Things like Beauty Counter, Mineral Fusion, those are 2 really good brands. So we're not putting hormones on our face and our makeup. Lotions, there are some big names, like some of the more popular brands of body care products. Just look at the ingredients on them and make sure you're not introducing parabens into the mix. So detoxing that. And then you can also take some herbs. Lots of good options there. One is DIM, is the abbreviation for it, DIM. And what that does is help your body clear estrogen. Um, and and then cruciferous vegetables are one of the best things you can do to promote good, healthy estrogen balance and clearance. So things like broccoli, kale, Brussels sprouts, all those good, healthy things. Um, and Also vitamin D. You know, when I was going through my functional medicine training, this stuck with me. I remember this so vividly. Our presenter and our educator on the topic of breast cancer said that he believes that 50% of breast cancers could be prevented with optimal vitamin D levels. And I know in the case of fibrocystic breast tissue, a lot of times that's linked with a low vitamin D level. So just a few things to check in on and look at. Also, detoxification, periodic detox programs where you're helping clear. Your liver is what helps clear all the extra estrogen. So sometimes when your liver's a little sluggish, it's time to detox it and get all that cleared out. So just a few little tips that you can do to check into that. And then of course, if you have a question and you want to do a free consult with me, that's the kind of stuff I do. So if you have a question, post a comment or just reach out to me for a free consult and I'll be glad to help if I can. Okay, thanks a lot. Have a great day.